The next slide, Zhengwan. Okay, so the city's COVID mitigation mapping program is built upon partnerships, collaboration, and networking. And we think those three things really provide the basis for sustainability of these kinds of projects. I hope that this will be a theme for us to be thinking that underlies this program, thinking about sustainability. The pandemic provided an opportunity to build on the expertise developed by the Secondary Cities Initiative. That was also a Department of State program. And that project was a field-based initiative to map secondary cities for resiliency, human security, and emergency preparedness. From that activity came the establishment of these three regional hubs, Asia, Africa, and Latin America. And when the pandemic hit, we were able to capitalize on this expertise to start to initiate this project, the C2M2 project, to examine second-order impacts of the COVID-19 through a geospatial lens. Second-order impacts, we'll talk about those in just a moment, downstream impacts, long-term impacts, these kinds of things. So not only are our hubs important in terms of the partnerships and the collaboration, but also the different organizations that have helped to support this, whether it's the American Association of Geographers, whether it's the NSF's Spatial Temporal Center, the Center for Geographic Analysis at Harvard, all of these organizations through the support and sponsorship of the Department of State. So this is where this comes from, this project that we'll be talking more about throughout the course of the next few days. Next slide, Zhengwan. So what I'd like to do is I'd like to now pass this off to have Dr. Lee Schwartz kick off the symposium and provide some background, some further background about the project, as well as moderate the panelist session that we'll be having. Dr. Lee Schwartz is a geographer of the United States. He's the director of the Office of the Geographer and Global Issues at the Department of State, and he oversees the Humanitarian Information Unit. And with that introduction, Lee, I'm going to pass it on to you. Thank you.
Okay, thank you for your introduction, Dr. Laitouri. And I'd like to welcome our online audience and officially kick off this 4.5-day long virtual symposium and workshop on the themes of the Department of State's Cities COVID-19 Mitigation and Mapping Program, which we call C2M2 for short. More colloquially, the program partnerships that are the heart of this symposium are designed to figure out how best to use geospatial data to tackle COVID-19 second-order impacts. And I use the word tackle intentionally because I believe geospatial data, if collected, analyzed, and applied appropriately, can be powerful enough to stop in its tracks many of the potential consequences of this highly infectious scourge that is still encompassing the planet, the impacts of vaccinations notwithstanding. The locational focus of our projects is exclusively on urban areas, many of which present unique challenges, are often operating at less than optimal capacities with regard to geospatial technology and services, but that have a trusted network of local champions and practitioners committed to seeing how more accurate, complete, and publicly available geospatial data can be a driver of both anticipatory and targeted strategies to minimize the cost, both in lives and in socioeconomic impacts of the COVID-19 pandemic. I'll try to get through my opening remarks quickly so we can get on with the program, but I'd first like to thank quite a few people and organizations for putting together what is an outstanding program of panels, lightning talks, and keynotes with speakers from more than 20 countries, not to mention the excellent posters that have been submitted for online display. First of all, I'd like to thank our co-hosts, Harvard Center for Geographic Analysis and the American Association of Geographers, as well as the National Science Foundation's Spatial Temporal Center. In particular, Dr. Wendy Guan from Harvard Center for Geographic Analysis and her postdoc up at Harvard, Dr. Jungwon Kim. And from the AAG, a special thanks goes to our longtime collaborator, Candida Manosi, as well as Colleen Doney, Lisa Shamus, and Giuliatti Nulipire. And finally, from my office at the Department of State, the Office of the Geographer and Global Issues, and specifically its Humanitarian Information Unit, we have Laura Klein, who is the Program Director for our city's COVID-19 Mitigation and Mapping Program, Erica Nunes, who manages our public outreach efforts as part of our office's mapgive initiative, along with paying attention to countless other details. And finally, who you've just heard from, Dr. Melinda Laituri, who is the Principal Investigator of the C2M2 program. A big thank to you all. Big thank you to you all. The online program contains quite a bit of information describing what the C2M2 program is. So I encourage you all to read through the first couple of pages of that program if you haven't done so already, in order to get a good grasp of the intent and design of our efforts. The genesis of the program, as Melinda mentioned, actually lies in the Secondary Cities initiative my office implemented and ran for about 5 years prior to the onset of the C2M2 program. The Secondary Cities initiative, which we refer to as C2, provided the basis for being able to launch quickly into a new initiative as soon as supplemental foreign assistance funding became potentially available at the height of the pandemic spread in the United States. When we were first contemplating initiating fieldwork in urban areas, urbanization as a phenomenon had not really been explored from a national security perspective. Like climate change, food and water security, and infectious diseases, my office at the Department of State actually tends to view these global issues from more of a human security and a national security perspective, and with a disciplinary lens grounded in human geography. Most of the world's growth, as you know, is occurring in urban areas, but over the past decade or more, this growth has not been primarily in the world's megacities or world capitals most people know about and have studied. Rather, most of these areas of rapid and often undocumented growth were in areas not as easily accessible to US diplomats and others working overseas. So we designed a program that relied on building partnerships based on a triad of local government, universities, and NGOs, and conducted community-based mapping projects in 16 cities over a 3-year period. From this project, we developed what we call a hub model, hoping to leverage top regional expertise to help sustain the partnerships once the funding ended. And we were fortunate enough to have 3 hub partners in Kathmandu, Nepal, Quito, Ecuador, and Douala, Cameroon, who we knew could help us launch projects on short order and with minimal funding, based on our tried and true model of relying on local coalitions of geopractitioners to both collect data and design analysis, ultimately for decision-making, and also for giving public access to open data. Following this model, the C2M2 program quickly established its 3 regional hubs in Asia, Africa, and Latin America. And these hubs, led by regional practitioners and organizations with deep expertise and strong networks, quickly identified and teamed with local partners whose projects were designed to use geospatial analysis to help address the challenges brought on by the COVID-19 pandemic. This pandemic magnifies and exacerbates many existing inequalities, and thinking spatially, generating data, and integrating diverse sources of information across multiple scales are all critical approaches to understand and mitigate vulnerability. While the global community grapples with the direct effects of the COVID-19 pandemic, local communities around the world strive to manage the second-order impacts of the pandemic. These so-called downstream impacts, such as strains on education systems, changing patterns of mobility due to restrictions on travel, and decreasing food security, can also impact informal economies and access to basic services in informal settlements, such as access to hand washing stations, sanitation, and electricity, certain things that much of the world takes for granted. So the US State Department Cities COVID Mitigation Mapping Program, C2M2, that you will be hearing about throughout the course of this week, aims to mitigate those second-order impacts of COVID-19 by establishing partnerships to generate unique geospatial data at urban scales, to expose information to the public and support local decision-making. At its core, the program is all about its partnerships. If we can go to the map, please. Not sure how visible the cities are on the map, but the C2M2 program includes 12 city-based projects, and you will hear from each of them during this week's lightning talks. Many of our C2M2 partners are working on common themes such as food security, health, informal economies, tourism, and the three themes of this week's symposium: migration, which is today's theme, livelihoods, and gender. And you can see the URL for the mapgive.state.gov program where the C2M2 project falls under. So before moving on, I'll say a few words about the structure of today's program. The theme of this first day of our symposium, as I said, is migration, and I'll be moderating that session. In many ways, I think it is almost better to couch this theme more broadly as mobility. And as such, we will explore examples of how increasing and decreasing movements during the time of the pandemic and its aftermath, locally and globally, plays a role in impacting urban communities, including not insignificantly its impact on tourism. There will first be 3 panel presentations, as well as time allotted for questions and answers at the end of each panel. Following a brief break, we will reconvene for 4 lightning talks, each from one of our project partners. These will be recorded talks from our C2M2 project partners in Kathmandu, Nepal, Santiago, Chile, Santa Cruz, Ecuador, and the Galapagos Islands, and Ouro, Preto in Brazil. So with that, I'd like to introduce our panelists for today and to remind them that the remarks are limited to 8 minutes, followed by a quick 2-minute Q&A session. And then following all 3 presentations, we will open the virtual floor for 15 more minutes of Q&A. So please keep your questions coming either via the chat window or by raising your hand. If we don't get to every question, we'll do our best to get responses from our panelists after their session is over. So I will introduce our first speakers, who are Nuno, Nunes and Ivona Zakoska-Todorovska from the International Organization of Migration. Nuno is the IOM Displacement Tracking Matrix, DTM, Global Coordinator, leading the team responsible for DTM system development, partnerships, operations, outputs, and data management. Working with IOM country missions and partners at different levels of the private sector, civil society, academia, governments, and international organizations, Nuno works on collaborative approaches in the field of humanitarian data operations. He's been managing the team involved in the design and implementation of mobility tracking operations, enabling a more data-driven approach to humanitarian relief and policymaking. DTM became possibly the largest source of primary data on internal displacement in the humanitarian sector. He also leads DTM efforts related to flow monitoring operations, including ethics and accountability measures. Nuno brings with him a wealth of experience in field operations, including managing humanitarian relief operations in a number of refugee camps. His partner in this presentation, Ivona Zakoska-Todorovska, also works for IOM as a regional displacement tracking matrix coordinator for Europe. She coordinates the DTM activities related to the monitoring of mixed migration flows in key countries of first arrival and transit in Europe. She co-chairs the Interagency Information Management Working Group for Europe, along with UNHCR and UNICEF as the other co-chairs. She has co-authored papers on the importance of data-driven responses along the Eastern, Central, and Western Mediterranean routes, and on the use of quantitative and qualitative data methods in detecting migrants' vulnerabilities and their evolving needs at different stages of their journey. In support of the global DTM team, she co-leads the recent work streams on monitoring mobility restrictions and the impact of COVID-19 on migrants. The title of their presentation is Monitoring Mobility Restrictions and COVID-19 Impact on Migrants. I turn it over to Nuno and Ivona. Thank you.
Thank you very much, Lee. Ivona here. Nuno is experiencing certain technical difficulties, so I will kickstart the presentation if that is fine with you, and he will be glad to join with the interventions in the questions and answers section. I'm uploading the presentation. Just need a confirmation before I start. If you can all see the slides?
Yes, but you need to start the presentation view.
Okay. There we go. Should be okay now.
Yeah, now it's very clear. Thank you very much.
Okay, thank you very much. So I'm aware that we have very limited time, and we'll jump straight into the topic of the first panel. It's a real honor, and thanks very much to Zhongguan and to Lee, as well as to Mel, for giving us this opportunity to present IOM's work when it comes to tracking mobility restrictions in view of COVID-19. Basically, to better understand how COVID-19 affected global mobility, IOM, through its displacement tracking matrix team, has developed a mobility restriction monitoring database to track and monitor the different restrictions and measures applied by countries to curb the spread of the virus. The mobility restriction monitoring is done through 4 distinct work streams. The first one being monitoring the operational status of the points of entry, whether that be land, air, or sea ports of entry. And on this particular work stream, the information is gathered on the geolocations of these points of entry and the changes in the operational status over the period of time. For this activity, we have greatly benefited from the vast network of IOM offices across the world, and the data on the operational status of the point of entry is updated and inputted by our colleagues in the different country offices across the world. The second work stream that we will be chatting a bit more on is the travel restrictions monitoring alongside with the different exceptions to these travel restrictions and the different entry conditions applied by governments to international air travel, and how these different categories evolved during the different waves of COVID and the different emergence of the different COVID variants. Here, the main source of information is secondary, so we collect information from IATA thematic platform, but we also collect information from the different government websites that are publicly available. In addition to these 2 work streams, as part of the mobility restriction monitoring, we are looking at the impact of COVID-19 on displaced and other mobile population, such as labor migrants, international students, seafarers, migrants left stranded and destitute due to the border and airport closures. More specifically, on the points of entry, so far we have mapped and monitored close to 4,500 points of entry, of which majority or 60% are land border crossing points, a quarter or 25% are international and national airports, and 15% are sea ports or blue border crossing points, as we call them in our classification. What is important to note is that while we do not know how significant is this coverage, because there is an absence of baseline reference number on the total number of points of entry across the world. However, except for airports, of course, that one we have. What is important to note is that still the number is quite high, and the frequency of uploading of or updating the operational status of the points of entry is on change basis, and it's done, as I mentioned, by our colleagues from the missions. As per the last update from last week, more than 50% of all the points of entry that we have mapped are fully operational. Another quarter are partially operational, and 15% are still closed for flights. When looking at the travel restriction matrix, which is the output that we have on monitoring international air travel, what we have devised is basically something which is called travel restriction matrix, and it is looking at a one-on-one interaction between the countries. What is the current status on international air travel between certain countries? If you look closely, both on the vertical and the horizontal axis, you have the countries and the list of all countries in the world, and where they intersect, there is a pixel, and the color of the pixel is basically indicating whether the international air travel between country A and country B is green, which means is open for travel, whether it's yellow if there is a partial restriction, or whether it's red if the travel is completely cut off. You will see quite a difference from the selection of snapshots that we have on how the, or let's say, world map looked like back in March 2020, when it was mainly green. The only red lines that you see are basically indicating the closure of international flights to and from Italy in the top, and then to and from the People's Republic of China. Then the situation dramatically changed in June 2020. As you can see, most of the international air travel routes were closed. Followed by the different, let's say, changes in the epidemiological situations, and in the summer, over the summer periods, the decrease of the number of COVID cases. We had a bit of relaxation and exchange, or a change from travel restrictions to travel requirements. So that is why October it's a bit more yellowish than the other months, because travel was allowed partially. But the situation then changed in December 2020, when the new categories emerged, and we see more restrictions applied either on the countries where the epicenters of the new variants of COVID-19, or toward those countries. Then the last and yet not least, you have see the situation between March and June, and how does it look this year so far. We have more openings, but also there are certain restrictions which are still remaining in place. Another visual presentation on basically the same data, which clearly indicates that in March 2020 only, for example, Asian countries had imposed any form of travel restrictions or conditions, where most of the Western countries had no restriction measures in place. The situation, as mentioned, changed in June as the virus spread out west. Most of European countries started to impose entry measures, while, as you see, in the US still has no or very little entry measures in place. The situation now in June 2020, most of the countries, territories, and areas in the world have imposed restrictions or conditions for entry, with the exceptions of... sorry?
1 minute.
So with the exceptions of certain travel bubbles or routes. And this is basically how the situation looks like in terms of the different categories that we try to monitor. We are trying to keep abreast of the different developments. One of the biggest challenges that we faced is the categorization of the travel restrictions, the exceptions, and the conditions for authorized entry, for which we are cooperating with partners. Last yet not least, I think it's quite important to mention how this has impacted the different population categories, either aspiring to move or are already on the move. It's basically exacerbating the vulnerabilities among migrants, or creating new ones, because the closure of borders has left a lot of categories without access to legal pathways for migration, basically forcing them to explore or rely more on smugglers and take more dangerous routes. The movement has continued, as mentioned, and we are keeping track on how these different changes impact not only the population on the move, but the different migration drivers. There are some basically case studies that we have pulled out based on all the information that we have collected. And as to adjust our methods of data collection on our regular work streams aside from the COVID work, but also to foster partnerships with organizations such as the World Food Programme, the Migration Policy Institute, and the World Tourism Organization. I will stop here. There is much more that I wanted to share with you, but I'm mindful of time and happy to reply to your questions.
Okay, thank you very much. And I'm glad you threw a map in there towards the end of the presentation. We have almost 200 people participating, so I'm not quite sure how the hand raising is supposed to work, Jungwon, and I didn't see any questions in the chat room or the Q&A, so maybe I'm missing something, but I have one question that I will direct your way, and that is, did you learn anything from the technologies and methodologies developed during the European migration crisis of 4 or 5 years ago, and apply that somehow to any of the tracking efforts for COVID-19 that were taking place, some of which were successful and many of which were not. So I'd like to know if any of that experience might have applied.
Yes, thank you very much. That's quite interesting. So as I mentioned, the main benefit was capitalizing on the network of data collectors that we had in place and the tools and the systems that we have developed for data collection. We have adjusted them to include indicators related to COVID-19 and how does it influence the decision-making process, or how does it hamper access to specialized services. So in that regards, we were able to cover some of the, let's say, most important flow monitoring points, or points of transit, entry, and exit, where migrants would be likely to be located. However, there were another locations which were coming up that we needed an extra effort to map and to set up assessment there. There are country reports, but also regional reports by the colleagues on how the tools were adjusted, and also what lessons learned did we apply. In particular regards to the European migration crisis and how we used lessons learned there, we did to a certain extent, because what we saw in this regards is in Europe we saw inflows toward Europe, but in the case of COVID we also saw an increased flows of return. So we were able to capture this as well using the existing infrastructure.
Okay, thank you. And I see we do have one question I'll try to sneak in from, I believe, Mohammed H.
Yes, I allow him to, Mohammed, to talk.
Okay, very briefly, please.
Mohammed, you can unmute yourself, yes.
Mohammed, if you're speaking, you're still muted.
Hello.
Okay, we hear you now.
Yes, I'm just wondering if we could work and together, and I don't know what is your plan for responding in such conflict area, such as Yemen, Libya, or a country that have been under war. How can respond during COVID-19? I don't know, it's the same with the base country, or it has different strategy or different plan to respond for this catastrophe. Thank you.
Okay, thank you very much, Mohammed. If you don't mind, Ivona, I'm going to hold that question till the end of these speakers. You've been working mostly in Europe. You may have some ideas on this, but I think it's a very important question that might benefit from a discussion for which we don't have enough time now. So thank you very much for that question. We will hold it. I'm trying to stay on schedule, and I'm warning our next speaker, Dr. Wang, that I will hold you to your 8 minutes, and I will introduce you very briefly. Wang is a professor in the Department of Geography and Environmental Studies at Ryerson University in Toronto, Canada. Dr. Wang's research interests include neighborhood and health, business geography, immigration and settlement experiences, and transnationalism. Her methodological expertise includes geographic information systems and spatial analysis and statistical modeling. Dr. Wang's research has been primarily funded by the Social Science and Humanities Research Council, the Canadian Institute for Health Research, and the Royal Bank of Canada's Immigrant Diversity and Inclusion Project. She has been published widely on the immigrant experience in book chapters and journals, including most of the major geography professional journals. So I turn it over to you, Dr. Wang, for your presentation on neighborhood health and prevention behavior in Toronto, Canada. Thank you.
Thank you very much. Can anyone see my shared screen?
Yes.
Perfect. Thank you so much. Thanks so much for the introduction. And it's a real honor to be part of this panel of this public symposium on the use of spatial data, mapping, and other relevant methods to explore impacts of COVID-19 on local and global communities. So in my presentation, I'm going to kindly ask you guys to kind of zoom in from the world map that you just saw at the last presentation to the most densely populated and the largest urban center in Canada, which is the Greater Toronto Area. And I'm delighted to be able to share my research looking at COVID-19 neighborhood variation and prevention behavior in Toronto. And my focus is kind of more on the receiving end of this migration process. So instead of looking at mobility and migration at a global scale, from a transnational perspective, I'm focusing more on the settlement experiences of migrants and international migrants in the so-called host country and in their health domain, particularly with regard to COVID-19. So just to give you a little bit background of the work that we're doing, very, very briefly, as you can see from this map. So I think I have in total maybe 2 or 3 maps. So the first map basically shows the percentage of immigrant population in the Toronto Census Metropolitan Area, which is the largest CMA, a census metropolitan area in Canada. You can actually see the proportion of foreign-born population at a census tract level. And in today's talk, I'm going to highlight the city of Toronto, which has almost, very close to 3 million population, and the entire CMA of Toronto has close to 6 million population. And you can see the level of diversity from those statistics, for example, in terms of the percentage of immigrants in the Toronto CMA. And also a bit of a background looking at migration, health, and the COVID-19. And we have seen a lot of research revealing neighborhood and area variations in COVID-19 infection rates as well as positivity rates. And we're also seeing an increasing amount of evidence and research looking at variations among different communities as well as by socioeconomic status, such as income, insurance, housing, access to care, access to testing, treatment, social support, etc. And pre-existing conditions also play a key role in this, and this kind of helps us to look at some of the more established theoretical frameworks, such as the social determinants of health. And for this kind of work that we're working on, we're particularly interested in exploring the relation among risk perception, prevention practice, and spatial mobility.
because the research has indicated that, people have different risk perceptions or different levels of risk perceptions often lead to vastly different prevention practices, such as, practicing social distancing, hand washing, wearing a mask, etc. And we're also trying to explore the spatial and temporal pattern of individual activity space. So drawing from an ongoing research project, and I'm going to highlight very briefly, first of all, the social and spatial patterning of COVID-19 across different neighborhoods in the Greater Toronto area, including the city of Toronto. And I'm going to highlight from our ongoing work some preliminary findings regarding the spatial and temporal change in individual spatial mobility pattern in relation to risk perception and prevention practices. And the project uses a mixed method approach, combining spatial quantitative as well as qualitative methods to analyze a range of data and data sets. So here is a map at the neighborhood scale showing you the COVID-19 prevalence rate across different neighborhoods. The city of Toronto has officially 140 neighborhoods. As you can see from this choropleth map, we're actually seeing a very unique spatial pattern, highlighting some of the neighborhoods that have high numbers of case counts, as well as high prevalence rates or COVID-19 case count in terms of percentage. So these neighborhoods are actually some of the are the top 10 neighborhoods that have the highest percentages in COVID-19 rates. And you can see those neighborhoods sort of in the more wealthy neighborhoods and the well-to-do neighborhoods that have some of the lowest prevalence rate of COVID-19. And you can actually see the percentages that range from the highest almost 14% to the lowest 2%. And for those of you who are not familiar with the geography of Toronto, and I can actually quickly show you another map, which shows the spatial distribution or the spatial pattern of material deprivation. And material deprivation index comes from a very useful data set called Ontario Marginalization Index. And these numbers are actually factor scores from the principal components analysis, highlighting the level of material deprivation. And you can sort of see a resemblance of COVID-19 distribution pattern to the deprivation pattern. And we have also run Pearson correlations that highlights a very significant relation between material deprivation and COVID-19 percentage, as well as COVID-19 cases in terms of percentage, and ethnic concentration index, which is measured by the percentage of immigrant population as well as the visible minority. So you can actually see a very strong, you can see a significant relationship between these two pairs of variables, and with a relatively strong and median relation. And here I'm going to show temporally how new monthly cases have changed from January 2020 to June 2021 within the 15 months. Hopefully this animation will play. That's February last year, March, and that's the first wave, April, May 2020, June reopening in Toronto, July reopening, August 2020, September 2020, October start of the second wave, December, January, February, March, the third wave, April, third wave, May, reopening, and June. So you can sort of see in the previous 3 waves of COVID-19, and you can actually see that those new cases are actually popping up from those mostly hardly hit neighborhoods in almost the same, with the same geographical pattern. So next, I'm going to highlight very briefly that some of the preliminary findings from our online survey conducted last year from June to November 2020. The survey actually asked a bunch of questions, very detailed information about individual experiences, how they have people have been impacted by COVID-19, especially their perception towards COVID-19 risks, prevention measures and behavior, as well as spatial mobility pattern. So we established 3 key timelines in the first wave. As you can see, February representing the early stage, April, peak of community spread, June reopening. We're hoping to understand from temporal as well as a spatial perspective how individual risk perception, prevention practice, and spatial mobility pattern have changed over time, and how these changes are actually shaped by ethnicity, as socioeconomic characteristics, as well as public health measures and policies, such as lockdown and stay-at-home orders. And I want to highlight 3.
You've got 1 minute, Dr. Wang.
Thank you. So there are 3 very interesting things I want to highlight, just very briefly. From a temporal pattern, you can actually see all those specific prevention measures like hand washing, wearing a mask, etc. We can actually see that the percentages of those who always practice those prevention measures change over time from February to June. And we can also see very important group differences between Chinese and non-Chinese. And also very important finding revealing discrimination towards Chinese and visible minority. And I want to offer some discussions related to some of the key points raised by the C2M2 committee. COVID-19's impacts on migration in health. We have found that the neighborhood and health approach extremely useful and helpful. And the use of geospatial data, and there's a number of options that researchers and policy analysts can consider, free data, publicly available data, as well as other types of data, such as primary data collected. We have learned a lot of lessons from conducting online surveys and virtual interviews during the pandemic. And mobile location data can also provide anonymized, aggregated device-level movement information as well. And in terms of methodology, we have also learned very useful lessons in conducting spatial as well as other types of analyses using with the COVID-19 and relevant data. And the potential areas for collaboration, I think, it's very important to conduct comparative study of different countries and cities, and to look at individual experiences and mobility pattern under different, for example, public health and insurance system. And multidisciplinary collaboration, bringing expertise from different fields is also a very important avenue. And last slide is our acknowledgement to other researchers, our research team, and communities and community collaborators and research, student researchers and RNAs. And we also want to thank all the participants who participated in our survey and interviews, as well as focus group. Thank you very much again for this opportunity to share our work.
Okay, thank you very much. I'm trying to see if I can find any hands that are up.
There is one question at the question and answer.
Okay. I've got it. It's from Yongmei Liu. The question is, from your analyses of risk perception and prevention measures adopted and health behavior changes, does the difference across racial ethnicity groups still show after SES being controlled?
Thanks very much for that question. So for this project, we're primarily exploring racial differences between the Chinese and non-Chinese group. So we have about 50% of Chinese respondents in the survey, as well as another 40-ish, like 40 to 8% of non-Chinese. And we are still in the middle of analyzing our data and writing a manuscript for publication. So definitely reach out to us if you're interested in the final results and findings. We are seeing some very interesting patterns, even social demographic and other variables have been controlled. We're still seeing very important group differences, as you can actually see from some of the preliminary charts and diagrams showing here. But we haven't completed our analysis yet, so definitely reach out to us if you're interested in them.
Okay, thank you. We look forward to the completion of the analysis, and we will hopefully get some more questions at the end of our third panelist, who I will now introduce. The third panelist and final panelist for this session is Dr. Nama Budhathoki, who founded and developed Kathmandu Living Labs as one of the exemplary institutions working in the areas of OpenStreetMap, open data, and civic technology. At KLL, Nama has been leading the Secondary Cities project since 2016, and now he is also guiding the C2M2 projects in the Asia Hub. Before founding KLL, Nama successfully led the World Bank's Open Cities project in Nepal in its inception phase. And currently, he serves as the Open Mapping Hub for the Asia Pacific region and as the inaugural regional director, where he works closely with OpenStreetMap communities from 25 countries in the region. I'm proud to say that Nama is a known quantity to my office and somewhat of a regional celebrity in the world of mapping in Nepal, with his efforts related to earthquake response and other critical developments that have been covered in many major news outlets, including the New York Times and the BBC. Some of the works he led at KLL have been covered in a variety of news outlets in Nepal as well. Nama earned his doctorate degree from the University of Illinois at Urbana-Champaign with a focus on OpenStreetMap. So with that, Nama, and I will say he also hosted me when I was in Kathmandu for one of the OpenStreetMap conferences that KLL hosted there. So over to you, Nama. Thank you.
Thank you, Lee, for your generous introduction. Junghan, I plan to share my screen. Is that possible?
Oh yeah, sure, yeah.
Thank you. Okay. Give me a second. Let me know once you're able to see my screen. Can you see it? Junghan, can you see my screen?
Yes, now, yeah, click that one. Yeah, now it's very clear. Thank you very much.
We've got it.
Thank you. Thank you again, Lee. C2M2, we have 3 C2M2 projects in Asia. One in Bangladesh, which focuses on migration, one in Nepal on tourism, and the third one in Mongolia, which focuses on developing the health information infrastructure. All these projects uses a combination of primary and secondary sources of data at the different levels. One of the interesting cross-cutting theme of the project is that all the projects contribute a part of the data they collect to OpenStreetMap. Lee, you mentioned about it. For those of you, OpenStreetMap is world's biggest open source publicly available database. So our C2M2 project also does have intent to try to share data as widely possible, as much as possible. So, before I get into the core topic of my presentation today, I want to show you a quick graph. Hopefully you're able to see it. So these three countries do have the COVID cases in the different levels, the first wave, second wave. Mongolia was doing fine, but the cases are growing now, as you can see in the graph. Nepal is worst hit. So given the population size of Nepal, and look at the number of cases, it's really bad, particularly the second wave. For last few months, you probably have been reading newspapers, hearing televisions. So it's not good. So on this pandemic has affected different sectors in the region. But what I'm going to talk today is how the COVID-19 has affected the tourism in Nepal. A bit of context. Tourism is important for Nepal because it contributes to almost 8% to the national GDP. 1.5 million people get directly or indirectly engaged in this sector. And again, I keep Nepal's population so to understand these numbers. And what was interesting is that Nepal government declared 2020 as the Visit Nepal. So they had a target to bring 2 million international tourists to Nepal in 2020. There are many hotels and many other businesses. They had a massive investment, for the visit year. So unfortunately, the timing was so bad. This project, the C2M2 project in Kathmandu, is trying to understand how the pandemic has impacted the sector. To give you a bit more context, so Nepal does have a variety of tourist destinations, of course, for all kinds of tourists. But that said, there are also a few important tourist hubs in Nepal. One is in Kathmandu, Thamel, one in Pokhara, which is 200 kilometers west of Kathmandu. Another one is in Chitwan. So what you see on the map is the center, all lines coming towards Kathmandu, the Thamel. So the workforce, they come to Thamel with different skill sets, as you can see here. I showed this map because pandemic has affected these people. It have forced these people to go back to their permanent addresses. So it's the same map, a little zoom version. Hopefully you can see things a little better. Now I just want to put this, what we call a causal loop diagram. We've been trying to understand the impact of pandemic in tourism sector, but tourism sector is huge. There are a number of things connected to each other. So it's impossible to fully understand the impact to each of these different elements. So what we have tried in this project is basically how has the pandemic affected the workforce? Because these are most vulnerable, the elements in the sector, because most of the people in tourism, they're informal worker because they do not have the official contract. In Nepal, there are a few months which is popular in the tourism, September, October, November, for example, and in February, March. So in other months, we don't have the same level of tourists. So it's not their full occupation also. So I just wanted to give you a sense of, the big picture. So now, so we did a survey to the workforce. And by the way, we designed a survey in collaboration with a number of associations, the workers' unions, because these are the people who eventually use this data. Otherwise, what happens is we collect data, we analyze data, and then we don't connect it to the decision makers' needs or policy makers. So in a way, the project had put a tremendous emphasis to bridge the gap between science and society. So not just to generate data, analyze data, but also bring it to the people who can actually use it and make decisions. So when we did this survey in April, May, just recently, so people say 65% people, almost 2/3, were unemployed. And other people did have some sort of employment. And then they do have several challenges for survival. So people say they have difficulty paying rent. Remember the map I showed you, the people from the neighboring districts come to Kathmandu or other hubs, and they have a rented apartment and they continue to pay the rent, and they can't do that anymore. And they do have loans, they can't pay that. They even cannot pay for food, So this is a sort of a humanitarian issue, humanitarian sort of crisis. We also talked to the businesses through surveys, the focus group discussions, one-on-one meetings with the presidents and other representatives of the associations. And the impact in business is that most of the businesses are temporarily shut down. And what is more worrying is that they said about 17% of business is permanently shut down. So that's a problem. So I forgot to mention in the earlier slide that many of the people who've been working in the tourism, they say they will permanently leave the field. So they will not come back and work in the tourism. That is going to be a huge loss for the sector because it will take years, to train people and develop these skills. Again, the major impact has been in the financial situation. They have difficulty to cover the operational costs. I'm talking about business. They even cannot pay taxes. Of course, they have challenge to get customers. And then we also asked them, what are the challenges you see for the next 6 months? Again, this was when we did this survey, the second wave was just beginning. So it was not on a full swing. They say the biggest difficulty is to pay the existing loans because most of the businesses have, they took loans from bank for the visit year, 2020. So now they have to pay it back and they really, cannot do that.
Now I may need to finish up soon, please.
Yeah, Lee, this is my second last, so I'm almost done.
Great.
So I think these numbers are self-explanatory. So I think the major impact on the business is on the finance. So, and then the question is, how can we adapt? The first thing we should try to do is to restore the livelihoods of the tourism workers because, they have challenge to meet even the basic needs. And then, when we ask them, what is your demand? And they're saying, they want loans without collaterals because they don't have property, any collateral, they can't, put the collateral to the bank. So for the financial, for the businesses, their demand is reduce the tax, subsidize loans, decrease the interest rates. And then one of the things that emerges from this conversation survey is that they really want to suggest to focus on the domestic tourism because within the foreseeable future, it doesn't seem that we'll be able to bring the international tourism. So that's the end of my presentation. I'll be happy to answer questions if you have. Again, these are the preliminary findings. It's work in progress. And if you're interested to learn more about this project, so there are different sources of information. Thanks, Lee.
Great, thank you very much, Nama. I think we probably have room for one question. We have a break scheduled at 10 o'clock, and then everyone needs to come back because we have some very exciting lightning talk presentations following the break. And then we have an excellent keynote speaker in Lars Peter Nissen. And by the way, he probably will be able to address the question of working in conflict areas that was raised after the first presentation. So do we have a hand raised for Nama?
By the way, in the meantime, Lee, I just want to tell that right after the break, the lightning talk will be from Nepal. So there will be more information. Right. This is kind of a nice flow between.
Right, and it's the first one up in the next session. And I see Dr. Wang is answering a question in the chat room already. Thank you. So let's move to a break right now. And we will then come back with some lightning talks. All right, thank you very much.
Yeah, great. Thanks for all of that. Just to follow up, just to let you know, we're just have a short break here. People get up, stretch their legs, and then we will be starting the lightning talks. And Lee, I think you will introduce those in just a few minutes.
Yep, I'm ready.
Okay, I hope people will start to return and we'll get some more people to be able to see the lightning talks. We'll get started in about 3 minutes here.
Now, should I start recording, or you remind me when you want me to resume recording?
Okay, thanks. Okay, I think we can get started again. Lee, if you wanted to introduce the lightning talks. Wendy, if you want to start the recording.
Okay, I am getting online. There we go. All right, so as I mentioned, we have 4 lightning talks, and each lightning talk will represent one of the projects being undertaken under C2M2 program. And as Nama previewed, the first talk is going to be a project that is taking place by our partner in Kathmandu Living Lab in Nepal. Each of these lightning talks is going to be recorded. So obviously the question and answer period will not be available, but we'll have hopefully some time afterwards to address some of the questions to the previous panelists if they are still around. I know they've been active in the chat room responding to some questions. So without further ado, I will introduce the first lightning talk, which is titled Echoes of Tourism, People, Process, and Plights. And it will be delivered by Deepak Raj Joshi and Sazal Stapit. Thank you very much. Over to the video.
because of its nature, tourism was one of the first sectors to be affected by the pandemic, and it will be one of the last to recover. And until we reach that point, hundreds of thousands of families whose livelihood depend on tourism will continue to hang in the balance. So we set ourselves two objectives for C2M2 Kathmandu. First, to capture the voices of this deeply troubled sector, and second, to make these voices reach the correct stakeholders who can actually help address these issues.
But we knew that this was not possible without the active support from the tourism sector. So back in February and March, we started forging alliances with tourism associations and workers' unions. Working closely with them, we decided to conduct 2 online surveys for collecting data, one for the tourism businesses and another for tourism workers.
We deployed both surveys online and leveraged our partners' networks to reach out to respondents. Both surveys captured data along the 4 dimensions of impact, preparedness, needs, and future outlook for COVID. In order to increase our outreach organically, we also added the share the survey feature at the end so that the respondents can bring in more respondents. With all this, we were able to collect over 300 responses in just under 3 weeks. The survey preparation, however, was a much longer process. We began back in January, a series of meetings and workshops with tourism associations and unions, and multiple iterations of questionnaires finally gave way to the published surveys in mid-April. As we collected data in these 3 weeks, we intensified our work on the second objective. We started preparing key findings and recommendations based on the survey. We set May 17 as the day to release these key information to the government.
The government of Nepal, especially the Ministry of Finance at that time, was doing its homework to prepare its national annual budget and program. So the May 17 event was very, very timely and relevant. Key personnel from the Ministry of Finance, Ministry of Tourism, Tourism Department, Nepal Tourism Board attended this event, along with the representatives of all major tourism associations and unions in the country.
With such a rich set of audience and policy influencers in place, we wanted to give a complete picture of the context behind our survey findings and recommendations. Hence, instead of just presenting numbers and percentages, we tried to weave them into data-driven narratives.
For example, one narrative talks about the complete stoppage of revenues as reported by 64% of tourism businesses. A popular coping mechanism was then to borrow more money, but as the numbers show, borrowing was not easy. And when asked for preferred financial assistance, many preferred long-term subsidized loans compared to non-collateral short-term loans. This narrative then led to the inclusion of this recommendation in our May 17 presentation. In order to curate and communicate these context-based narratives to a wider audience, we've compiled them on a website too. Each of these narratives try to tell a fuller story of COVID's impacts, the needs that have generated thereof, and what should be done next. The idea is to present a holistic picture to the policymakers and decision makers and to minimize the risk of looking at particular statistics in isolation. And we've also tried to back our narratives with the anecdotal stories which we've collected from the ground.
Surveys give us numbers and statistics, but we also wanted to give these numbers a human context. Our in-person interviews with the tourism entrepreneurs and workers help us do exactly that.
Santiago here owns a shop in Tamil, a tourist hotspot in the heart of Kathmandu. He started working in tourism when he was 13, but after giving 3 decades of his life to tourism, COVID has forced him unfathomable questions at the likes of him. He says, "At one point, me and my wife thought of buying a cart to start selling vegetables instead, but buying the cart meant giving up on 2 weeks of food and supplies. We simply couldn't afford it." Online stories often fail to capture such nuances and subtleties, so through these stories, we hope to draw attention to thousands of similar stories on the ground. For the past 2 months, we've been publishing such stories online. Our goal is to spread these stories with the hope that concerned stakeholders will pick them up and use them to inform their advocacy and actions. The litmus test of our efforts was the national budget released on May 29. Out of the 24 recommendations, 15 have made it to the national budget. While we do not claim the sole causality for the inclusion, but it does reflect on the relevance and usefulness of the efforts that C2M2 Kathmandu has put in over the last 9 months.
We are now looking at our survey data for geospatial patterns. We have already created standard univariate products like district-wide distribution of our respondents or how reported tourism occupations vary across districts.
Other relatively complex products combine several survey questions. For example, this map depicts the nature and distribution of tourism skills that Kathmandu draws from its surrounding districts. The idea with these analyses is to identify if there are geographic patterns regarding COVID-related impacts, preparedness, and needs, and to pass these on to tourism associations, unions, and the government. These products aim to aid their mitigative plans and actions.
जुन KLL र जुटुबको संयुक्त आयोजनामा आवश्यकता अहिले तत्कालको आवश्यकता के हो त त्यसको लागि चाहिँ हामीले नेपाल गभर्नमेन्ट र विभिन्न NGO INGO थ्रु यसलाई चाहिँ निराकरण गर्न सक्छौं जस्तो लाग्छ.
My challenge was there was no reliable statistics, no research on gaps in strength, without which the roadmap or any plans forward is not moving in the right direction. So when this research was done by Kathmandu Living Lab, it enabled me to understand the current situation. And with that, I was able to lobby with the government with the actual facts. I want to really thank you for all the support.
Okay, I'm assuming that is the end of the first lightning talk. We will now move on to our second lightning talk, which is titled COVID-19 and Territorial Dynamics of Crime in Santiago, Chile, by Juan Pablo Luna and Brian Castillo, who are from our C2M2 partners in Santiago, Chile.
Thanks very much for having us here. We are the C2M2 Santiago team, and we are going to present the secondary effects of COVID-19 in the metropolitan area of Santiago related to crime dynamics. What you can see here is just to give you a flavor of the type of data we have and the incidence of COVID-19 in the metropolitan area of Santiago. We have data for 52 municipalities in the city. And as you see, I mean, the pandemic rolls out during 2020 and now in 2021. And it essentially concentrates or has a harsher impact in the peripheral areas of the city, where most of the urban poor and marginalized sectors live. This is where the socioeconomic elites. Sorry, these are the. This is the place where the socioeconomic elites live. A couple of weeks ago, a paper was published in Nature Human Behavior reporting data for 23 cities around the globe, and they found that and reported that across the world, COVID mobility restrictions had an impact in decreasing criminality and different types of crime: assault, burglary, robbery, homicide, vehicle theft, and theft. And they claim this is kind of a universal effect, even if there are some variants related to different types of crime. What we try to do here is to analyze in a greater depth the dynamics of crime in the city of Santiago, which is not covered by that study, and which and that study also lacks the type of fine grain or more granular geographic data that we seek to make sense of here. What you have here is in this dotted line is the first national quarantine on COVID, and as you can see, if you look at violence and property crimes, you see a sharp decrease as reported in the Nature article of criminality in Santiago. In terms of the geographic distribution of that reduction, you see that the commercial area of the city, this is downtown Santiago and one of the upper sector neighborhoods that it's more commercial and that has a greater incidence of violence and property crimes, sees a sharp decrease in criminality rates, which are essentially due to these areas of the city and the whole city shutting down, right? And criminality resumes once mobility restrictions start to be rolled back. If you look at violent robbery and intimidation, you see a similar pattern, less incidents across the city, and the geographic distribution being reshaped also by the mobility restrictions, right? You see this type of crime being concentrated in the peripheral, like first ring of the city. This continues to be the case until the quarantine is made effective, which happens here. And as you see, I mean, you again see a decrease in its impact until it eventually resumes, but not reaching the previous levels. However, if you look at homicide rates, what you see here is a gradual increase or a focused increase in some municipalities of homicide rates. And if you look at the geographic dynamics here, again, the quarantine is enforced at this point, you see an increase of homicide rates in peripheral areas of the city, which are the ones where most narco-trafficking gangs with territorial control are located. Right? This is what you see in this map. Sorry, my mouse is going crazy. This is a map that combines socioeconomic status. This is high upper status. The bluish you get, the reddish you get is lower socioeconomic strata, and the green areas and shapes you see here, the polygons you see here in green, are areas where like systematic reports on gangs and narco-trafficking are being produced by the police, right? So you see homicide rates increasing, particularly in this area of the city, which is the one that it's more heavily populated by narco-trafficking gangs that are fighting for turf in these areas. And finally, if you look at domestic violence against women, you see also a decrease in the reports and the claims about domestic violence. And this is weird because qualitative reports and press reports at this time spoke a lot about and very frequently about how mobility restrictions were increasing cases of domestic violence. So our hunch is that claims on domestic violence are reduced because males are all time in the household, and women who are subject to violence and that report violence in other like to the media, in like there's a lot of discussion about this and how poverty is associated with greater levels of domestic violence, but claims to the police about domestic violence get reduced in this period. So in sum, we see very different dynamics, but by type of crime and its interaction with mobility restrictions. We see a relocation and a reduction of crime against property and robbery and intimidation. We see more homicides, probably related to territorial disputes and turf between gangs facing merchandise shortages due to the also the closure of the border areas where drug come into Chile. And we also see a sudden drop in the reporting of domestic violence that goes against anecdotal evidence of greater levels of domestic violence due to overcrowding in particularly in poor neighborhoods. And we think this might be related to the continuous presence of males in the household, making women less able to file claims to the police. So many thanks. This is what we have so far, and we look forward to your comments and questions.
Okay, I guess I can say thank you very much to a video. Another very good presentation. And now that brings us to our third lightning talk, which is titled Inside View of the Secondary Effects of COVID-19 in Touristic Cities, the case of Puerto Ayora in the Galapagos Islands. This is going to be presented by Indira Espin, who is part of our C2M2 partner team, working, I believe, out of Santa Cruz in the Galapagos, Ecuador. So let's turn it over to that video. I see there's a whole team getting credit there, including Carlos Mena, who's our champion in the regional hub in Quito. Thank you very much.
Hello everyone, my name is Indira Espin. I am from the Galapagos Island and I am part of the team C2M2 in Puerto Ayora. As an introduction, the Galapagos National Park was created under an executive decree on July 4th of 1959. The executive considered as national park 97% of the land surface because of its high ecological value, becoming the first protected area in the country. Galapagos is also the place that inspired Charles Darwin's famous theory of evolution by natural selection. Another important title is that the Galapagos National Park was declared a Natural World Heritage Site on September 8, 1978. The city of study is Santa Cruz and it's located in the center of a group of islands. It has an area of 986 kilometers and an altitude of 864 meters above the sea level. It has around 15,000 people living in this island. The purpose of our research is to analyze the secondary effects caused due to the COVID-19 and the collapse of the touristic cities such as Santa Cruz in the Galapagos Islands. We will start by learning about the current COVID situation in the islands. Since the immunization plan to vaccinate the population of the Galapagos Island, the cases have been dropping dramatically. Now we have 0 cases in 3 islands, and this is Isabela, Floriana, and Santa Cruz. So far, we have only 1 active case that is located in San Cristobal Island. The research question is, what are the local impacts caused due to the COVID-19 lockdown, the consequences of the measures taken in economy and social aspects? The data we have is that the health emergency caused by COVID-19 caused a sharp fall in the tourist activity in Galapagos. In 2019, 270,000 of tourists entered the Galapagos, and in 2020, 73,000 tourists entered the Galapagos Islands. This graph represents the number of tourists arriving to Santa Cruz by nationality. In the bar graph of 2019 and 2020, you can see that there are more Ecuadorian nationals visiting Galapagos than any other nationalities. This is followed by Americans and then English people who also visit the Galapagos in those years. The This is the number of tourists and crimes in 2019 and 2020. During the pandemic, the national park records 73% drop on total arrivals to the Galapagos Island in 2020. The greatest impact on the reduction of the visit was registered during the second and third quarters of the 2020. As we can see also in the right graph, we have seen that in 2018 we have more crimes reports than other years. Police records shows that crimes such as theft are most common in neighborhoods of Puerto Ayora. These are the daily crimes, and this paragraph represents the daily crimes by year in Santa Cruz, where we can see that theft is the crime that has been committed the most in those years. So this is our hotspot map, where we can see the reports of crimes from 2019 and 2020. As we can see, some of these spots, like the blue ones, are pretty much staying in the same areas. They tend to expand on the months where we had more tourists, and as we can see also we have the red spots areas, the red and orange spots, and those are located more in the touristic zone of Puerto Ayora and Santa Cruz, and at the same time we have reports of these crimes that are more likely to appear when we have a high season of tourists coming to Puerto Ayora. And here we have our last hotspot map, and these maps have names by colors according to the stages of the lockdown. Red represents months from March to May, which was the beginning of the pandemic, so we had very strong lockdown. Yellow represents months from June to August, where we started to have less restrictions. And green light represents months from August to December, where the local and national government allow some of the business to start reactivating their activities with a biosecurity plan. So this is pretty much my presentation. Thank you so much for your time.
You're muted.
Thank you. Sorry about that. Let's move on to the fourth and final lightning talk of the day, which is titled COVID-19 Lockdown Effect, Touristic Demand, and Criminal Dynamics, a micro-scale geostatistical analysis of the historic center of Ouro, Preto, Brazil. And this is delivered by Braulio Figueiredo da Silva, who is one of our C2M2 partners out of Brazil. And I will mention that the abstracts of each of these lightning talks are available in the program. So with that, let's go to the video.
Hi, my name is Braulio Silva. I'm professor from Department of Sociology at Federal University of Minas Gerais, Brazil. Today, I will speak about our study that we try to relate the COVID-19 pandemic with social mobility and crime. We try to use a micro-scale analysis in the area center city of Ouro Preto. This is my team, Ryerson, Daniele, and Rinaldo, both from Federal University of Minas Gerais. In this study, we propose to evaluate if the decrease of the flow of the people in the streets, for example, because the COVID-19 pandemic has affected the special patterns of crime in the center city of Ouro Preto. We are using two important criminological theories. One of them is a routine activist theory, and another one is a crime pattern theory. Both try to explain how crime concentration happen in the space. We have a research question here in this study, how the COVID-19 pandemic reduced the routine activity of the people on the streets, changed the spatial concentration of violent crime. We try to understand the spatial variation of the crime in the city. We have three hypotheses here: COVID-19 pandemics impacting the urban mobility. Here, measured as a proxy of the number of reviews in the TripAdvisor platform. We are using the number of customer reviews of restaurants. The low urban mobility impacting the spatial concentration of violent crimes. And the last hypothesis is that there is a temporal lag between the end of the lockdown and the comeback of the services used and criminality in the space urban. We try to understand how crime changed in the space. We have a study area. We define the study area because we have a very high concentration of the attractive restaurants and facilities in Ouro Preto, in the center of the city, and the crime too. We can see the same maps in the same area concentrated both crime and facilities in Ouro Preto. For them, we decided to study a specific area, try to make a micro-scale analysis. If you look the number of reviews, restaurant reviews before the pandemic and after that, we can see two different patterns here. We have a pandemic moment, we have a before period where we have a lot of posts, reviews. We have a moment immediately post lockdown, and after that, the last one, we have a tourism recovery, the moment and the people back to use the facilities and the tourist services. We look the same times we try to look the same time the spatial distribution of the crime in the same period here. We can see that we have a different pattern post-lockdown. In the first map, we can see a pre-lockdown concentration, spatial concentration in the center of the area. In lockdown, we have a little bit change, but in post-lockdown, we have a very decrease in the spatial hotspots in the area. But in the last moment, when people back use the service, that means more people in the streets, we have come back the same spatial distribution of the crime in the study area. We try to understand what changed in this area because these moments. We use the mean center statistical geostatistical analysis, and we can see here that in the first moment pre-COVID, we have a center mean. After that, we have a lockdown, a little bit change. But here, when you have a post-lockdown, we have a very huge change in the mean center of crime distribution. And when we have a tourism recovery, the mean center back very close the first period, the analysis. Our conclusion is that many studies have analyzed the impact of COVID-19 pandemic on crime using time series in the scale of the cities or even large areas. We propose to study the impact of COVID-19 pandemic using information about travel review as a proxy are urban mobility in a micro scale. There are many possibilities to collect data of urban mobility, but we believe that travel review is a good one because it reflects how people are using services in the attraction, and we have information, geographic information about these posts review. It's interesting to observe how the COVID-19 pandemic affects the spatial concentration of the crimes in the historic center in Ouro Preto, especially in post-lockdown phase and when we have a return or period of tourism recovery. With the reduction in the tourism demand after COVID-19 pandemic, there is a spatial displacement of crime, possibly due to a new social spatial configuration in the territory, but it's a new steps in the study. Thank you very much. If you have some questions, please send me a message.
Okay, that ends our lightning talks. And I know that we've got some tremendous back and forth going in the chat room. In particular, a lot of people are providing their contact information, some of the research they're doing, some information about the organizations that they're working for. So please view the chat room, and I think we'll be able to make all that information available as well. Also, in the interim, there were a number of questions that were already answered that were raised that we didn't have time to get to in the first panels. I know Dr. Wang answered a question about the correlation between COVID-19 outcomes and socioeconomic status, which she showed in her map. And Ivona answered a question or two on the one of the questions that was asked by Mohammed Hamran on working in conflict areas, where she posted some articles on IOM's work in Libya, and also some information on some of the timeline mapping that she and Nunes have worked on. So I think, despite the fact of not getting around to having a rich question and answer session following those panels, it looks like we got around to the most pressing questions that were asked during in the chat room during the presentations. I believe we are on time. Let me check my schedule. Are we scheduled to begin the keynote speech? No, of course we're not on time. So let me move then immediately to introduce our keynote speaker for this session, who I believe has patiently been following along as a participant. I'm very pleased to introduce Lars Peter Nissen. He has worked in the humanitarian space for more than 20 years, and he has lived and worked for extended periods of time in Latin America, Africa, South Asia, often in conflict areas. He is the director of ACAPS, an organization he helped found in 2009 that provides analysis and assessments of both natural and man-made emergencies in dozens of countries around the world. And I am proud to say I've been familiar with Lars Peter and his work even before 2009, and I've always been impressed at how he tries to think provocatively and creatively about how best to promote humanitarianism as well as to protect humanitarians. And while in his role at ACAPS, he is busy helping to run an independent nonprofit NGO that strives to conduct groundbreaking humanitarian analysis, Lars Peter is known as a true collaborator in the circle of humanitarian practitioners. And he also enjoys teaching disaster management at the University of Copenhagen and hosts a weekly podcast titled True Humanitarian. The title of his talk alone precisely wrong is certainly enough to provoke interest and curiosity. So please give your attention now to Lars Peter, and I will follow up at the end with moderating a brief question and answer session to close the first day of this symposium. So over to you, Lars Peter. Thank you very much.
Thank you very much, Lee, and thank you for the opportunity to speak today and for all of the presentations that we've seen today. It's been really interesting to follow. Over the next 20-some minutes, I'd like to basically take you through three things. First, I'd like to speak a little bit to where do I come from? What is my community of practice, the humanitarian sector? What is the role of ACAPS? And the type of analysis we provide and our whole approach to things. I think that is important for you to appreciate the work I'll try to show you today. Then secondly, I'd like to walk you through some of the products we have put out over the course of the past year in an attempt to analyze COVID, to make it more concrete. How did we actually answer to the challenge of COVID? And then thirdly, I will try to answer the question as to whether we in ACAPS were precisely wrong with what we provided in terms of analysis of COVID-19. And when I chose that as the title for today's talk, it's because I think that when we started this whole terrible situation with COVID, when back in March 2020, when it became clear just how serious the situation was, my biggest fear and my biggest concern for us as ACAPS, apart from the safety of the team, of course, was whether we would be able to rise to the challenge of providing an appreciation of the crisis, which was approximately right rather than precisely wrong. Before I jump a bit more into that and explain what I mean by that, I'd like to share my screen if that's possible. Let me see if I can do that. Must be here.
Yes, we can see your screen. Very clear.
You see the screen, right? So what you see here is basically our website, and rather than a PowerPoint presentation, I have chosen to walk you through some of our products. And again, the purpose of this and the aim of my talk will not so much be to go through the actual analysis that we provide, or the findings that we come up with, but more for you to have a look behind the scenes and understand our approach, what kind of thinking actually informs our way of doing analysis. But first, a couple of words about ACAPS. As you see on the top of the page, it says, see the crisis, change the outcome. And I think that's probably the thing I say the most often when speaking about ACAPS, is that for us, it is equally important that we on one side see the crisis and provide as accurate as possible an analysis of the situations that we deal with, and on the other hand, that we change the outcome. And by that, what I mean is that we have to have eyes on the decision makers. We have to ensure that the analysis we do does not just paint a pretty picture, but actually also changes behavior in the decision makers that we target. And I think that's where we in the humanitarian sector are in a quite unique situation in the type of decision-making support we provide. Basically, we more or less constantly operate in situations of high ambiguity, high uncertainty, extreme time pressure to make decisions, and very dynamic situations. So we often are not entirely clear on what the problem is. We very rarely have adequate information about what the situation is. We have to do something really quickly, and the situation is changing all the time. From a decision, in terms of supporting decision making, that's about as difficult as it can get. And very early on in the first years of ACAP's existence, we made some massive mistakes in really serious crises. We went to Pakistan during the floods in 2010. We were at the Haiti earthquake in 2010, and we did not perform very well in either of those. In both of those contexts, we adopted too heavy and slow an approach to the crisis and did not change the outcome. We did not inform decision-making in any significant way. And that was extremely painful for us to waste resources, time, and not be able to make a difference. And so ever since those early, quite painful operations in 2010, for us, what has been extremely important is that we're not a think tank. We don't sit in Geneva, and I'm in Geneva right now, I should have said that. We don't sit in Geneva and think and provide a clever analysis. We are a do tank. We have to provide analysis that's quick enough to actually hit the decision maker before he or she makes a decision and changes the outcome. And that's the challenge we pose to ourselves internally. How can we be quick enough to put out analysis that informs decision making even in the first hours of an earthquake or a flooding or another sudden onset crisis? To do that, I think the easiest way to give you a flavor of how we do that is basically we have 3 rules internally that we try to stick to and that define our approach. And these are the 3 things we never change. Everything else we sort of mix up and change to fit to the situation with. Rule number 1, know what you need to know. So you have to empathize with your decision maker, understand his or her information requirements, and know why you are collecting data. When you're in a very fast-moving situation, if you don't know why you're collecting data, there's a very high likelihood that that's not going to be useful. So for us, it always starts with who is our decision maker? What's the difference we're trying to make? How do we understand the situation? And then we can start collecting data and figuring out what we need, figuring out the answer to the question. But start with knowing what you need to know. That's rule number 1. Rule number 2, it's linked. It's makes sense, not data. Early on, we spent a lot of time collecting data. Not very useful. We underutilized it. We did not analyze it properly. And the return on investment in terms of the money and effort spent on that data collection was just not big enough. So for us, analysis is the centerpiece, not data collection. And that's again a thing. When I look at the humanitarian sector, I'm not sure we're doing well enough there. And that for us is the second guiding principle, makes sense, not data. Thirdly, when you are in a very fast-moving situation, there's a very high danger of providing too granular analysis that's not going to be up to date or quick enough to hit the decision maker. So our third rule is don't be precisely wrong, be approximately right. And that's, of course, where the title for this speech comes from. So precisely wrong would be a very granular analysis of an evolution at the district or village level, when actually it takes you so long to do that the situation has changed by the time that you get the analysis out, or that you would start analyzing based on an inadequate analytical framework. And that's where I'd like to pick up on linking to COVID-19 and the work we did there. Because I don't think I've ever seen a more unpredictable or difficult to understand crisis than the global pandemic. And I think it's still the thing that I try to keep at the forefront of my mind is just how high levels of ambiguity we're dealing with and how little we actually know about how the secondary effects of the pandemic or even the primary effects of the variants, for example, are going to play out in the years to come. But we do know that they're going to be significant. And each of the presentations that I've seen today provides a little piece of that puzzle. The question is, what does that add up to? If you add up all the little effects, all the little butterfly wings being swung around the world by COVID-19, what's the picture going to be? That's a really difficult question to answer, and there is a significant risk that we end up being precisely wrong in answering that question. So we have to proceed with great care. So that was sort of the mindset we had a year and some months ago when we started embarking on this analysis project of COVID-19. And the first thing we then did was we sat down and we discussed this whole thing. We got a whole bunch of actors together in Geneva, and we started figuring out what are we doing, what is happening here. And we quite quickly realized we do not have an analytical framework for this. We don't actually know what our assumptions are. how can we comprehend this crisis? And so the first piece of work that we put out quite quickly was an analytical framework. And you see that here. Let me see, I hope you can see this. Now, I think the first thing you note is that this looks more like a children's drawing than a serious piece of analytical work. That's on purpose. We wanted to communicate with this drawing just how top level and how, how uncertain in a sense this analytical framework were, and that this is something we are still working on. This is something we still are trying to fully figure out, but this is our best take at this stage. We also had some other visualizations, sort of spreadsheets with a lot of breakdown of the different components and so on. But when we looked at it, we thought, no, this actually tells the right story. This colorful, almost playful depiction of what we mean by COVID secondary effects, that's the right way to tell that story. And so basically what we're saying is, we have the pandemic, that's the yellow box, the primary effects of that. And then we have that red arrow going around. That's the policies and behaviors that we as a community, as governments, have in response to the pandemic. Those two factors play together with the pre-outbreak context, the underlying vulnerability. And what we want to do is understand how the pre-existing conditions, with the primary effects and our reaction to that, impacts humanitarian outcomes with respect to health, living conditions and essential services, social cohesion and protection, and for us specifically humanitarian and development operations. We want to make sure that we then map out what are the changing humanitarian outcomes over time with respect to which groups are the most vulnerable, which geographical area are most vulnerable, and as I said, and do that over time. That simple drawing and that, in a sense, very banal depiction of what secondary effects actually means have been hugely helpful for us. It has helped us communicate clearly to our partners and internally what are the areas of focus whenever somebody came up with a new idea about what we wanted to analyze. We would go back to this and say, okay, so where does it fit into the analytical framework? Does it? It doesn't really fit, does it? Should we really do this? And so it helped us create a shared awareness of the nature of the problem we're trying to analyze. And I think that's something we often, in more stable settings, tend to forget. Right? We would take it for granted that we actually have a shared appreciation of the problem. So that's the first product I wanted to show you. Our very basic analytical framework that we put out, I think, within a week of us actually beginning to analyze COVID, and I think getting it out early and visualizing it the way we did was extremely helpful. The next question we asked ourselves was, so what's the scenario? What's going to happen? Sort of top level for the humanitarian industry, how will this actually affect our operating environment? And it obviously it's been hugely disruptive to us that an industry that depends on being able to fly around the world to some of the more difficult areas to access was unable to move. So we thought, how can we help the industry think through the impact of this crisis and see how we deal with it? And we came up with 3 fairly simple scenarios, and they're basically structured around, one, the power dynamics in the sector doesn't change. The donors and the big UN agencies and the INGOs who get the bulk of the money in this crisis, they will maintain control, and we will somehow tweak and adopt the response mechanism and make it work. But it is pretty much muddling through without any bigger change. The second scenario, we said, so maybe actually the fact that we rely so much on external input but are unable to provide it will mean that national actors gain influence, that more money will have to be channeled through local actors, and that will reframe the power dynamics in the sector. It's something we discuss quite a lot in the humanitarian sector, how to increase localization, how to deconcentrate power. We sometimes talk about decolonizing humanitarian aid. And this scenario sort of we're helping the sector think through what are the dynamics here. So the third scenario was increased national control, and humanitarians, international component is basically sidelined and will lose influence and support. This is important to say that this should not be seen as sort of a prediction of futures. It is more a question of trying to stretch the mindsets of an industry in terms of how will this affect you? How can we operate in this context? And just to show you quickly what some of the underlying work is, it's not just a few words on the page. We basically try to keep the description to one page, but then we do quite a lot of work in terms of mapping out both the methodology underpinning this and the different compounding factors that may come along. Elections, for example, might make things worse, large-scale natural disasters, which always come at a very inconvenient time. Just giving you a flavor of what the document looks like. Methodology, and then an overview of the triggers, right? So what kind of actions might trigger scenario 1, 2, and 3? As I said, I'm not trying to provide you with an in-depth understanding of what the scenario actually get. I'm trying to give you a flavor of what the different products do. And so we began with an analytical framework saying this is what we think the problem looks like, and these are the areas and ways in which we look at it in a very basic way. We then tried to think top level around what might the possible futures look like. And then we jumped in and said, okay, so one of the few things we can actually pick up and measure fairly accurately across the globe is what are governments doing about this. And so we constructed a government measures data set that compared at a global level what types of measures were put in place in terms of restrictions, difference between continents, social distancing, public health measures implemented, and we did, and we go to the bottom here, we did a taxonomy of the different types of government measures. Now, we updated this on a monthly basis for around the first year of the pandemic, and I think it's been downloaded between 60 and 70,000 times by different actors. And we have been able to see that this has been used both by humanitarians that we normally serve, but also by, for example, Booking.com, different private sector consultancy companies, and so on. And so what we think we managed to contribute with this type of product was a global comparable data layer enabling different organizations to analyze the situation more or less, not in real time, but with a fairly current rate, to be able to map out how the ways in which governments reacted in different ways to this played out internationally, and for organizations to then do their planning accordingly. So a global framework, a couple of scenarios, and a frequently updated global data set to enable people to keep an eye on what government measures are like. Those all play to the global level, but that, as a humanitarian, is not good enough. So what does it look like in the Rohingya camps in Cox's Bazar? How do we manage to convey the impact of COVID-19 in a densely populated refugee camp? And one of the ways we tried to do that was by trying to tell a story in a different way. Data can be very cold, it can look very clean and scientific, but does it actually tell the real story? And are we forgetting that at the end of it are human beings who are affected in different ways? And so you can see how we here are moving from sort of data analysis more into a storytelling space, trying to map out what does this mean at a very granular level for the individual sitting in a refugee camp or being on the move somewhere. Then let's jump to something else. Education. What does it look like in Iraq? What has been the impact of COVID-19? And again, you'll see here where the people in needs, what are the severity of needs, a basic overview of the situation. Then, what was this stuff? Sorry. I'm sorry, I meant to show you a different report. This one here. Sorry. A global analysis of the impact on education. Well, first we begin with some key figures. What is actually the impact of the closure of schools that we've seen across the globe? Then, what is the impact here actually? It's not just about learning, it's also about protection, it's about food and nutrition in certain parts of the world, it's about health. And so, how do we again, in a more storytelling way, convey what is the impact here, so that when we look at the cold data or the big data sets, we have an analytical framework and an understanding and appreciation of the crisis, which also includes the individual kids not being able to go to school. So, key figures, a cartoonish overview of impact, and then global comparison of how has schools been affected globally? Where have they been closed? Where are they fully open? Where have they taken an academic break? And this, the first one is at the peak, 2nd April 2020, and this one is in October, so we're able to do a comparison over time of how things have changed. Again, the point of this is mainly to just give you an idea about how we, through different types of analysis, both quantitative but also much more qualitative, try to provide humanitarian actors and other decision makers with a number of analysis products and information products that enable them and empower them to do their own analysis of the situation. So this is very much about, we very much see our impact through the agency of others, so providing augmented, adaptable products that can be embedded in other people's analysis is key to our approach. So I hope that has given you sort of an idea about the type of analysis and the type of approach that we've chosen in relation to COVID-19. And I'd like to then just answer the question I posed up front, were we precisely wrong? I don't think that's a yes or no answer. I think on one side, I'm fairly confident that where we got it right was on issues such as the analytical framework, the global government measures database, providing those global tools very quickly, and we could see a real uptake of those products, and we could monitor how our data would show up in different analyses very early on. And so that, I think, the global appreciation of an extreme black swan event, a very unpredictable, ambiguous situation, I think we scored some very early runs on that account. Where did we then not get it right? I think what I have worried about is whether we then use that global level of analysis to then zoom in and provide granular input in the right places. And so I've shown you some information from Cox's Bazar, for example. So the reason we did that was we had a team in place in Cox's Bazar. But what about all the places where we were not? When we started out with this crisis, one of my preconceived ideas was that I thought Zimbabwe would be really hard hit. I spent 4 years in that country, and I know how tough a time it has had over the past years, and I was really worried that this shock would then tip that country into an even deeper crisis. And then what we saw was that certain countries in Latin America then suddenly got really hard hit, and that had never crossed my mind. And so I think where we internally try to challenge ourselves on whether we did well enough is whether we were able to not just provide that global overview and those global products, but also zoom into really where were the key areas of concern. How did we make the decision about what to look at? In a sense, it's a street light and shadow situation. Are you only looking where the street lights are, or are you also looking in the shadows? And I'm not convinced that we were good enough at that. That's at least the challenge that internally we are posing to ourselves. Could we have been sharper in terms of really diving in and providing quick analysis in the areas where this pandemic then hit hardest? So I hope that has given you an idea about how we approach this crisis. And as Lee said, I've worked in the humanitarian sector for a number of years, and I can't remember ever having dealt with something that was as difficult to understand as this. It's not that I haven't worked in difficult situations, but intellectually to appreciate and understand the magnitude of a global shutdown like this, and the way in which the most vulnerable populations across the world have been affected by that I must admit has been very difficult. And I think we got some of the way with our work. I don't think we're satisfied that we got far enough. That's what I had for you today. Maybe the last word from my side would be the reason I chose to share this with you is that I think the secondary effects of the pandemic is going to be with us for many years, several years at least. And I would hope that we will continue to challenge ourselves to make sure that we actually challenge our analytical frameworks, challenge our preconceived ideas, ensure that we pick up how this pandemic, how the secondary effects are battering some of the most vulnerable populations that we have in this world, and that we can use that knowledge and we can speak truth to power and provide some real clear analysis that enables decision makers not only to see the crisis, but also to change the outcome. Thank you very much.
Thank you very much, Lars Peter. That was a very provocative talk, as always, applying a lot of your tried and true methodologies to the latest crisis we have. And I was struck by the fact of how complicated you say this one is, because I know you've been involved in many of the world's most complex emergencies. So that is telling. And by the way, I did neglect to congratulate you on Denmark's victory in the face of crisis, given what happened to Christian Eriksen in the European Championship. So it was nice to see that the country rallied behind the team and they're able to advance to the next round. And I know that makes all of Denmark very happy, gives them something to get excited about as they're hopefully coming out of this pandemic. So I apologize to the rest of you for that segue. Anyway, a couple of things I just wanted to mention to kick off some questions and answers. First of all, I thought it was very interesting that you led off with the need to ask the right questions, and the fact that this is not dissimilar to a lot of humanitarian crises you've worked with as a global pandemic. We usually think of a lot of these crises as being unique in their nature, but at the end of the day, if you don't know what data you're looking for, and you don't know what questions you're asking, you're wasting a lot of time. You don't get a good return on investment. And that, I think, the most important message I got for our projects that we're trying to work on is that the key goal is analysis. Data collection is only a step on the way to analysis that will hopefully inform outcomes. And so we are still in the early stages of our 12 projects, but at the end of the day, we need to make sure that we can use the data we're collecting through participatory and collaborative means to really generate some good analysis. And of course, the context is also critical, and that is why we have focused on the local context for our projects, the urban environment in particular, which is a challenging one to work with, particularly in areas of the world where the urban populations are rapidly expanding. And within the context of those local environments, you also mentioned, very importantly, that you have to keep in mind the national context as well. There are budgets, there are strategies, and there are policies at the national level that can't be ignored. And so that while the projects take place at the local context, integrating them with national strategies and priorities will be key to get get traction in entire countries that are dealing with this problem. So thank you very much for providing us with that context. And I'm not sure what we have exactly in terms of questions, other than a question, the very first question that was asked by Mr. Mohammed Hamran, I believe, who has done work in Yemen, among other places. And he wanted to know about how we approach the challenge of responding to COVID-19, primary, secondary impact in parts of the world that are under severe conflict now. And maybe a few words on that you can provide from your personal experience, in addition to your work with ACAPS. And then if we still have any of the speakers on from the earlier session, I know I see Ivona on, and I believe Nama is probably on, and I'm not quite sure if Dr. Wang is on, but I'll give them the chance to respond as well. So over to you, Lars Peter.
So that is a real challenge to be able to analyze when it's so difficult to access. And I think maybe what characterizes the humanitarian industry is that we are used to quite a severe loss of control, and we're not used to having very good data. And I think that forces us into a space of analyzing in the way that I have described over this past half hour. So if you go to ACAPS and actually look at what we do, it's quite old-fashioned human analysis. I mean, of course, we use quantitative data. Of course, we use more sophisticated methods. We use satellite imagery and stuff like that. But the backbone is good old-fashioned human analysis. And I think the reason that works is that it's because of the ambiguity. And Lee, you spoke a bit about it, but I'm sure we've all seen those reports around lipstick and mascara, how lipstick sales have dropped dramatically because everybody's wearing a mask, whereas mascara has gone up because your eyes are a really prominent feature when you're on a camera. I'm wearing neither today, I should maybe add. But imagine 50 effects like that, 50 effects that are obvious once you see them, but you had no clue would happen before, right? And imagine those different effects cascading. How does it affect the border driver in Uganda that he has been unable to go out and earn his daily living as a motorcycle taxi? How has that? And then if on top of that his household gets sick, what are those cascading effects? What about the countries of political instability that are certainly have to lock down? We've seen the terrible statistics on domestic violence. What does it add up to? How do these effects cascade and interact with each other? What's that storyline? That is a very, very difficult question to answer. And I think we have to be very careful not to jump in. So just to come back to the question from the colleague from Yemen, for us, in ACAPS, the answer is good old-fashioned human analysis, talking to people, talking to stakeholders who knows the context really well. And then, of course, analyzing whatever data we can get our hands on that's more quantitative. You're muted, Lee.
Lee, you're on mute. Lee, you're muted.
Yeah, I see that now. Thank you. Let's give a chance now to the previous speakers from today to respond to that same challenge. Let's go to Lou first, if you are still on. Or Nama or Ivona, whoever chimes in first.
Sorry, Lee, Ivona here. I can pitch in my 2 cents. I was trying to find the raise the hand button, which is hiding somehow. Just wanted to echo what Lars has mentioned about the characteristics of this crisis. And for us that have been working in different humanitarian settings and different crisis situations, what we actually saw is basically that the system for preparedness that we have been working so long to capacitate were not actually up to the challenge to respond to these types of crisis, because it was super fast changing in pace, but also it was requiring a different level of coordination and pace of reaction. So what we have seen as lessons learned and what worked, let's say, in multi-country traditional humanitarian settings, in the setting of COVID was not really functioning. So it took us a bit of time in order to regroup and come up with different approaches. First and foremost, in regards to data collection, because this is what was missing, the evidence base in order to reframe those operations. So we saw that, let's say, the humanitarian assistance bit being delayed, not only due to the border closures, but also due to the different let's say restrictions in place, and even more so due to the fact that we needed to figure out what is needed more, whether it was prevention types of services that were supposed to be extended, and or shelter and accommodation, or even return options for the migrants that were stranded. Then we needed to know whether the priority was in camp-like settings on quarantine facilities, or different types of medical interventions. So it was quite, let's say, a unique situation that we had to operate. And even when we were looking at the travel restrictions, we saw that some of the countries were pretty quick in setting up exceptions for humanitarian flights and medical evacuations. Now, when going back to the question on working in countries which are highly affected by conflict, COVID has added additional layer of complexities to already a complex situation. It has further limited the access to the locations and to the territories. But as I mentioned in the beginning of the presentation, we tried to adjust the methods and tools for data collection, and we also tried to let's say gather more information. How is this impacting the affected population more closely in order to change the responses and the intervention? Yemen, for example, was quite an interesting context, because it's a major transit countries for migrants from Eastern Horn of Africa on their way to the Gulf Council Cooperation countries. And we saw a lot of difficulties when migrants were either trying to continue their journey or trying to return back to their home countries, because of the closure of the borders, not necessarily only linked to COVID-19, but also due to the different conflict and natural disaster crisis. In the situation for Libya, and we tend to gather the data on displaced population within Libya internally, but also to collect data on how the COVID-19 impact has affected the labor migrants in Libya, because Libya, despite the different conflicts, is still a country of destination for labor migration for countries from the region. So what we saw in Libya is basically a decrease in the migrant population in Libya between 2020 and 2021. I think February was the reference month, of some 60 to 80,000 migrants, which is showing that despite the fact of immobility and people not being able to leave Libya, there have still been some returns from Libya to countries of origin. So it's quite complex. Also, as rightly pointed out by the colleagues, and there is no magic formula on how to devise the the data collection, but also the responses, and it's guided, I would say, by the context, little bit by lessons learned, and a lot by and it should be guided a lot by information that we collect.
Okay, thank you very much. We do have one person who's had a hand raised very patiently, so I want to give that person an opportunity to ask a question. It is Efosi Ajay Ajagbe. I believe you will be unmuted and allowed to ask your question.
Hi, Efose, you can now unmute yourself.
In the meantime, we had a question in the chat for Lars about which countries you're having the school closure impact analysis.
So I think the analysis I showed you, the report I showed you is global. So we actually cover the whole world. It's a global comparable data set. We then have some countries, I briefly by mistake showed you Iraq. So we have some countries where we do more deep dives, but this provides an overview.
Got it, thank you. All right, if we do not have Efose able to weigh in with his question, then I will turn this back over to Melinda Laituri because we are at the time to close the session. I want to thank the panelists, the lightning talks, and Lars Peter for providing a great start to our 4 days worth of symposium sessions, and thank all of the audience participants. I believe we had about 200 on the symposium today. And now over to Melinda. Thank you.
Okay, thanks so much. Thanks everyone for participating. And let me echo Lee's thank you for all the panelists and the keynote for the rich discussion and presentations we've had. Quickly, just a couple of closing comments here. Thinking about the common issues that COVID raises for around the world. First of all, thinking about, it's hard to parse out these issues as individual issues. It's like pulling a thread and unraveling the entire fabric as we start to see so many things that are impacted and the overlapping impacts that they have. It means that in trying to understand social and spatial patterning, we see how complicated and complex they are. It makes it so important for collaboration. I think the other issue is this question of scale across space, time, and people. When we think about scale, we're looking at anything from neighborhoods to the global. With respect to time, we're seeing this measured in multiple waves of the pandemic that's ongoing. And in terms of people, we're seeing this from individual to international scales of understanding individual choices and decision-making. So trying to figure out how we can really address these very important issues of the pandemic. The third issue is the importance of integrated methods. We know we're not looking at just geospatial data. We're not looking at just one single analytical question, but we're trying to devise these frameworks that create these very rich mixed methods approach to try to figure out, again, how we can solve the seemingly intractable problems we're facing right now. So just a reminder, I hope you can all attend tomorrow. Our topic for tomorrow focuses on livelihoods and the economy. We have another great keynote address that will be for tomorrow and another series of panelists. Please be sure to visit where the post-event survey is so that you could give us some feedback about the day. Also visit our mapgive COVID C2M2 site to see more about the project and be able to communicate with us about what we're doing. So I look forward to seeing you tomorrow, and thank you so much for attending, and thanks for all the assistance with this from the support team. With that, I'll close it. Thanks, everybody.
Really great day. Thanks, everybody. Really appreciate your time and contributions.